Okay, well, good morning, everyone. Thank you all for joining us today. We have a very, very full agenda. We're very honored to have our County Health Department Director, Larry Johnson. He's going to kick it off today. He has, with his team, released some really good quality information to help businesses look at what they need to do to be safe when reopening, and that's an email that you all should have received. So Larry's going to kick it off, and then we're going to hear from Tom Cook at the Cook Family Foundation, who's going to give a nonprofit update. This is actually a pretty significant day, Giving Tuesday. I'll let Tom talk about that. And then we're also going to start today, this was mentioned briefly yesterday, we're going to start today with highlighting individual businesses that have a product or service that would be helpful to companies as they look to reopen. So we're actually going to start today with a regular caller and commenter, Barry Paxton from Right at Home. So several speakers on the agenda. It should be a very robust call. So with that, I would like to introduce Larry. Larry is doing a great job for us at the county level, working to protect public health in Shiawassee County. We've been talking regularly throughout this process. I think he's being very professional, very fair, and very focused on protecting our health. So I think he's doing a great job. And I wanted Larry on the call today because they have released these guidelines that I think are very informative, very beneficial. And I wanted Larry to be able to talk to that. And certainly if anyone has any questions, we can do that as well. So with that, I'm going to turn it over to Larry. And Larry, feel free to say what you need to.
Justin, can you hear me?
Yep, you're good. Go ahead.
Okay, I just had to figure out that *6. Okay, thanks everyone. Really pleased to be here today. These are challenging times. I thank Justin for all he's doing to help with the businesses and industry in our community. It's just awesome. He and I have been working very closely together throughout this whole process, and that you don't always see that with government and business interacting. So for that, I'm very appreciative. I want to get right into it here because your time is valuable. Start with the case update in Shiawassee County. We have 185 cases and confirmed COVID. The good news on that is we've leveled off the last few days. However, there is more testing capacity now, and we anticipate more cases as the testing continues to expand. Memorial Healthcare has just been awesome to work with. They've been doing so much testing in the community, specifically related to the long-term care facilities. You're probably all aware of the challenges that we have been facing with the cases. Probably more than half are involved in long-term care facilities. It's just devastating for these places. Whatever reasons the disease gets in there, whether it's the resident going to a doctor's appointment being brought back in or an employee bringing it in, they're shut-ins, and it's just been really difficult. Right now I think we're around probably half, a little bit more than half of our cases involve those centers, but we also have seen the virus hit the younger generation. We have a 6-year-old that tested positive, recovering at home, but still just goes to show you that it can and does hit anyone. Nationally, we're pushing 70,000 deaths, 1.1 million cases. There's been discussions out there about how they define the cases and whether or not people are just listing COVID even though they had underlying conditions. Well, the facts are that most of these people do have underlying conditions. They really do. However, developing COVID tends to expedite the person going downhill and then even dying. So some of these individuals, would they die eventually? Well, yeah, they would, but COVID has just wreaked havoc on them, and if their immune systems can't fight, then they can't survive it. So underlying conditions are listed on death certificates, but COVID is also listed on the death certificate. People talk about the flu. I've heard a lot of chatter about that. Yes, the flu does kill every year. and 30 to 50,000. But the COVID virus has killed 70,000 in 7 weeks. So that just kind of puts it in perspective for you. I try to push aside the chatter and the conspiracy theories to try to stick to facts and science. So with that, I want to move into some of the things we're doing here at the county. Obviously, for you guys, this isn't going to be a flip the switch process. We need to roll this out and methodically, and we need to do it right, because I really don't want to be back here again in 6 months or next winter. I hate to see things close down like this. It's just been devastating. So if we can do this appropriately and continue to maintain safeguards and social distancing, I think we can get to where we want to be, and where you all want to be, which is open, and that's where I want you to be. No matter how you look at it, your employees and the public are going to have fears even after things start to open up. And what that looks like, you need to be thoughtful for your employees, to try to provide them with the necessary PPE if you're dealing with the public, and also for the public, trying to create a safe environment in your business or organization so that they feel safe when they come there. And you're seeing a lot of that around the community right now. There's a great partnership between High Quality Glass and SL&H, where they're making these plastic shields for businesses and for the county. The county's installed them now in all of their public departments. And today I'm going on a facilities tour to look at that. So just those kind of things, masks being made over at Woodard and different things have been just awesome in the community. So what I'm trying to say with that is, under the governor's executive order, we are required to wear masks in all indoor public spaces. So if you can medically handle wearing a mask, some people can't, but if you can medically handle it, you are required to wear a mask in public indoor spaces. So what that means for businesses is, if you have public or if you have employees that are dealing with the public and you need to provide them with proper PPE, and you've probably seen some of these businesses like even Meijer or Home Depot that have a sign on their door that says you got to wear a mask. I've been in some of these businesses. I would say the majority of people are abiding by that. Some aren't. You're always going to have a few actors that don't play in the sandbox, but the majority of us are doing what we need to do, which is why we've seen the curve start to bend and why we've seen the positive changes occurring on the national level, because of the majority of us doing what we needed to do. So for PPE, I can get a list of vendors to Justin to share out with you. I don't know them all on the phone right now. I do know that the county ordered 500 surgical masks for employees just to start. And those are coming online. They seem to be available. They seem to be accessible now, whereas about a month ago it was pretty dry. Also, we've got an abundance of face shields right now. Now those are a little bit more here at the EOC. Those are a little bit more, I'm not going to say intimidating, but it covers your whole face with plastic, like you see at a doctor or a dentist's office. I can't promise those to everyone, but we do have an abundance of those. We're trying to get them out to our frontline employees. That the EOC has been heroic. They really have. That's headed up by Jeff Weiss, emergency manager, Phil Hevelin from Health and Wellness, Casey Elliott, Jody DeFren, all the people that are involved in that. And so we have pushed out tens of thousands of pieces of PPE to Memorial Healthcare, to our frontline workers at the nursing homes. And also we're working closely with the Duran Union Station as they continue to be a hub down there for helping us with PPE. So many good things are happening. I sent out a document that Justin shared with you. Of course, after I sent it, we found one typo in there, but we've since fixed that. You know how that goes. And it's considerations before reopening your business. It's very easy to read, easy to use, and it's something that you can use as a guide. And obviously it's talking about hygiene practices, providing those PPE and hand sanitizer, increased cleaning and disinfection of your facility. Those kinds of things make your employees feel safer and make the public that are going to come in and buy your products feel safer. Spacing out the seating, in encouraging anyone that doesn't need to deal with the public that can still do telecommuting for a while. We're going to recommend that. Not everyone can do that, especially in service businesses, but that does help. So I would encourage you to use those. Also included in that is a workplace screening form. This is a very generic form, and it's not, and we're not putting it out there to create a undue burden on businesses. What I'm trying to do is encourage them to do a subjective screening for these employees. Have you had a fever? Do you have a cough, shortness of breath? So once you use this form and you can screen your employees, if you have access to a thermometer, even better. But the problem is thermometers are really hard to buy right now. We're even having trouble acquiring them here at the county. So that's why I wasn't going to do a mandate where everybody has to temp their employees, because we just don't have the thermometers to do it. So if you have one, or if you've got access to them, then I would definitely encourage that. And if you have an employee that's sick, then they should stay home. You shouldn't have them in your facility until, we want to be 72 hours fever-free. And then if they have the symptoms, then obviously we want to get them tested. I'm not going to get into the testing at Memorial, because Memorial has set up tiers of testing for essential workers, non-essential workers, and then the general public. I would leave that to Memorial to I don't know if they're on the call, but if they are, maybe they can talk about what they're doing with that. They have a center set up at Chestnut Street in 21, where they're scheduling appointment testing. Now, I do know that they're charging a fee for that, and I believe they're trying to charge either the municipality or the business, so they don't have to just charge individuals. And for the COVID test, I think it's 110, and for the antibody test that they're supposed to get going this week, I think it's 55. Don't quote me on those numbers. I would leave that to Memorial Healthcare.
Hey, Larry, it's Justin.
Yeah, go ahead.
Brian Long, the CEO of Memorial Healthcare, is actually going to be on the call tomorrow. So.
Oh, excellent. Then you're going to get a real good update on that.
Yep. Thank you.
Good. Just a couple more things here, because I know you guys are busy. So I want to kind of leave you guys with hope. Things are starting to open up, and now we're going to see things. If we continue on this trend, to improve each week. The numbers are leveling off. The curve is bending. And real hopeful signs on a vaccine. You heard the president talk about it over the weekend. They've got 83 different companies working on vaccines around the world. 6 are in human trials right now. And they're hoping to get something going in Europe this fall and possibly into the United States by the end of the year, January 1. It's an ambitious goal. It's kind of like, I don't want to say put a man on the moon, but it's amazing to bring a vaccine that quick. Once we get that vaccine, you're going to see everything just take right off. I mean, because then people are going to have, they're going to have the security to know, and hopefully by then we have some more herd immunity. Also, we have some positive signs with antiviral drugs. Remdesivir is one of the big ones that's had some real positive effects. So we're staying on top of all of that. One of the things that the county's going to have to move towards is mass vaccination. Once the vaccine becomes available, it's the health department's responsibility to coordinate vaccinating 70,000 residents. Now, that will be a huge undertaking that we just can't do ourselves. We'll be working with many partners on that, but we're going to be the central pod, if you will, location where that vaccine comes in, and we'll have to dole it out, and we're going to want to get everybody vaccinated. So we have been incredibly busy. Hats off to my staff. My nurses are working 24 hours, 7 days a week, some of them, on the contact tracing, which is such a huge part of this. So they're chasing down each individual and all their contacts that might have had a positive test. And so I'm so proud of the team I have here, and then working with the EOC, Emergency Operations Center. That's been fantastic, working with Jeff Weiss. And so I want to say my hat's off to you businesses. This has been devastating. I can't put myself in your shoes. Proud of all you businesses, and I enjoy coming out and using them. And I don't know if you follow our Facebook page, but we put our updates on there daily. And, last weekend was beautiful weather, and I encourage people to go out and use our county parks with social distancing. We need to be outside. There's positive signs to sunlight and humidity and heat. So we're encouraging that. Now, next weekend's not looking as good, so I'm not going to tell people to go outside. But anyway, I just want to thank you all, and I can take a few questions if you have them. Hopefully I can answer them. And what do I do here, Jess? Do I put this on *6 or just mute it?
No, you don't need to do anything, Larry. If anyone, though, does have a comment or question for Larry, you're going to want to hit *6 yourself. So anybody have anything for Larry? Any questions or comments? Hit *6.
Oh, you can't let me off that easy.
Hi, Larry. This is Laura at the YMCA. I'm sorry. Did I interrupt you, Justin?
No. Go, Laura. You're good.
Okay. There's been some conversations I've been involved in, Larry, about trying to help find volunteers to be trained as those tracing, contact tracers. Is that something that you see a need for here in our county as we start to reopen and get back to a different new normal?
Yes, I do. And
Okay.
I can be in touch with you more on that. Nicole Greenway is our director of nursing, and she's
Right.
organizing her nurses. And we've reassigned staff, obviously, that were not doing their other jobs. And we managed to hold out so far, but now this thing is going to continue to take off. So that might be – now the state is coming up with a plan, and we don't know how that's going to look. With the state, you never know. It's day to day, hour to hour. But I really appreciate that, Laura, because we get in a pinch, we're going to need more hands on the deck.
Okay, well, just reach out. Just know that we're here, and like I said, I've been involved in some conversations, so let me know what you may need.
Thanks, Laura.
So, Larry, we know that construction and real estate are reopening, I believe, Thursday this week. Do you have any sense from the state, kind of what might be next in terms of timelines? I've heard industry might be around the middle of the month. Anything you can update us on?
Yeah, so the stay-at-home order goes till May 15th, and that's kind of the aggressive one that keeps us kind of in our place of domicile. But the state of emergency is different. The governor extended that to May 28th, and that is more for funding and gives some flexibilities for protections of healthcare workers. I know that she did keep the restaurants and the bars closed until May 28th. I would expect that when we begin to reopen those facilities that it's going to be layered, maybe 25%, 50% occupancy to start. And that's just me talking, just because she's taken a conservative approach. And obviously we would support doing it the right way. I know we got to get people back in these restaurants, but we want to do it the right way. And that's where the social distancing and these steps are going to come into play. Other businesses, the outdoor stuff's obviously starting to open up now. Construction's going to go here Thursday. Things that are less risk, those are going to be first. I've heard that the big auto companies are getting ready to restart, but I know that a lot of their employees are scared and concerned. So be ready to deal with the employee portion of this. Especially if you've got a lot of employees, you're going to have to deal with that. And so what we've tried to do here at the county is be proactive by taking all these steps for providing them PPE, putting those plastic shields up, doing the things, because, you're always going to have a few that don't even want to be there working. But at the same time, you need to protect your people and protect your customers. So that's a long answer, Justin, but I don't have any inside tips on anything breaking loose soon. I will say one thing, though. I know there's been concerns. We've had some calls on enforcement. That's being handled by the sheriff and the local law enforcement, and then our environmental health division is assisting with that. Out of all of the calls we've received, there's only been 2 citations issued up until today for violations of the governor's executive order. So we're not out picking on people. I know there's a few things that came about yesterday, and that's being handled. But we're not looking to find trouble on this. We're just trying to get people to play ball and get through this, and we're almost there. We really are. So we want to be careful on doing this. We want to roll it out the right way. And I don't want to be back here in 6 months talking to you guys on this call like this. So that's what I got, Just.
Okay. Any other comments or questions for Larry right now? Anybody have anything? Hit *6.
Hi, Larry. This is Colleen. You hear me?
Yes, I hear you.
Okay. I had a question about cash when you're making sales. There's a lot of people saying that, money's dirty. Do you have any recommendations of what we should be doing and how big a risk we're really dealing with when we're talking about making sales with cash instead of using cards?
Yeah, that's a really good question, Colleen. Yeah, cash is dirty, and it is higher risk. So we are encouraging touchless payment options if possible. Credit cards are a little bit easier because you can disinfect them. People can disinfect them. You can put wipes out if you have wipes and stuff. If you're taking cash, you can do things like wiping down the counter and so on and so forth. And you can have the person taking cash wear gloves. And then, obviously you don't want them handling food while you're doing the cash, but or whatever your business may be. So cash is definitely riskier than doing the touchless payment or the credit cards or payments over the phone. But a lot of your businesses, you depend on cash. So you're going to have to take some precautions when using cash. I know a lot of people have these phones now that can scan their payment through their phone, and some of the businesses downtown do that. You got some where you can put the card in the thing. You don't even have to touch the machine. So being creative, it's going to take some creativity, but anything you can do to reduce handling cash would be a positive. Thank you.
Thank you, Colleen. Other comments or questions for Larry? Hit *6.
Hi, Larry. This is Gail Gail from the Lodges of Duran. I just want to thank you so much for all the cooperation we've received from the health department, for the PEE, and most of all for testing all of our staff and residents. We were sure we had a case, even though we didn't have any symptoms. And to this day, we don't have a symptom. But of course, we had positive cases. So I can't thank you enough. I feel that you've helped us save lives in our staff and our residents, and I highly commend you for doing that. Thank you so much.
Well, I really appreciate that. That's nice of you to say. I haven't always gotten a lot of compliments the last 7 weeks, but I want to say your facility went above and beyond doing proactive when it came to that. So I appreciate that. Thanks a lot.
You're very welcome. And I've worked with 12 other counties, and I have not seen the advancements that the Shiawassee County Health Department has made. So thank you so much for all your efforts. You couldn't understand how much we appreciate it.
Thanks.
Thank you, Gail. Other comments or questions for Larry? Hit *6. Okay. Well, Larry, if people have a question for you, what's the best way to get a hold of you?
Oh, you call me right at the office here. I'll give you my number, 989-743-2318. That's my number. So call me anytime if you have any questions. We're an information resource center too. So
very good. Any final comments or questions for Larry? Okay. Well, Larry, once again, thank you. You're doing a great job protecting us here in Shiawassee County. Appreciate your time today, and keep up the good work.
Thanks a lot, Justin.
Okay. Well, wow, that was a great update from Larry. A lot of good information. As was mentioned, we will have Brian Long from the hospital on the call tomorrow, and he will be talking about that testing issue. So please definitely make plans to join us for that. I want to change direction a little bit here and introduce Tom Cook from the Cook Family Foundation. I know some of you know this, but probably quite a few of you don't. The Cook Foundation, Cook Family Foundation, is an amazing organization, amazing nonprofit that has been instrumental in helping so many other nonprofits in Shiawassee County start and grow and succeed, including our organization. They were a cornerstone of our founding 18 plus years ago now. So very grateful for the relationship we have with Tom and the rest of the Cook family. And they're continuing to do an amazing amount of work to support our nonprofits through this challenging time. So I want to give Tom just a couple minutes today to give you an update on what he's working on. Tom, go ahead.
Hey, thanks, Justin. It's great to be here, and it was great to hear from Larry. Known Larry for a while, and we're fortunate to have his leadership at the health department. And yes, the Cook Family Foundation, as I'm sure some of you know, we've been involved in education and some scholarship things, but we've also been working with nonprofits going on many years since we started, and had a formal nonprofit capacity building program for the last number of years. And we're maybe a little bit like a venture capitalist in that we make key investments in nonprofits, and we provide them with some technical assistance and direction. We're not as interested in starting nonprofits as we are helping the established ones in our county. There's a 20-some nonprofits that are locally based that have staff, and they all have important missions that improve the quality of life in Shiawassee County. And it's the quality of life that got us started, but we've been thinking a lot in these times about their economic impact as well. You probably know that our number one employer is a nonprofit, Memorial Healthcare, and that's true throughout the state, where about 1 in 10 jobs are with the nonprofit sector. In fact, they're bigger than the hospitality industry. So we care about what they do to make life better here, but we also care because they do have an economic impact on our community. They're a lot like small businesses. There's a lot of passionate people that run them, very committed to their cause, very committed to their business, very committed to the local community. They're all very entrepreneurial, and they're looking for ways to support themselves, and these current times have given them challenges. You think of organizations like the Lebowski Center that rely almost entirely on ticket sales, or even Duran Union Station that has a lot of facility rentals. They've been particularly challenged in these times. Other groups rely on grants, really good at delivering what we might consider to be a governmental program, using governmental grants, but doing it in a much more local way, and being much more effective in what they do. And of course, a lot of them rely on donations and sponsorships, many of them that you have supported, and they're all struggling with how they get through. I've just been really proud to work with them in the last 45, 60 days as they have thought about how do they get through this crisis and respond. Many of them are being super entrepreneurial. Larry made reference to Duran Union Station, which has made a complete shift in their purpose. They were about to close down and lay everybody off, and instead decided, we're going to work on masks, and the Cook Family Foundation gave them a grant to help them do that. Very proud of that, and it's been just a really great thing for them to become a hub for mask collection and distribution, and that's been great. Other nonprofits being equally as entrepreneurial. I've been working with Laura at the Y, figuring out how they might help address the food issue in our community, and all that's very promising. Today is Giving Tuesday now, which is sort of an echo of Giving Tuesday, which usually happens at the end of the year. So you see a lot out there on social media, and maybe some emails from nonprofits that are trying to encourage generosity and support in any number of ways. That may be volunteering where that's appropriate, but I would say to all of you that have some relationship with a nonprofit, you think of some event that you typically sponsor for them or otherwise partner with them. Think of that, if not today, then as the year goes by, about how you can continue to support and work with them. Our website, cookfamilyfoundation.org, has a little recap of how important nonprofits are and a link to the 20-some nonprofits that are based here in Shiawassee County. And as well, attention today on the COVID Response Fund that's administered by the Emergency Operations Center, the EOC. That's there to help people in need. They've been partnering with a number of our nonprofits to do that. So donations to the EOC, the COVID Response Fund, you can do through raiseupshiawassee.org. That's a partnership with United Way, another great institution that engages the business community, as does the Shiawassee Community Foundation. The three of us have sort of been the backbone of this Raise Up Shiawassee effort, and excited to partner with all of them. And then finally, I'll just say to many of you I know serve on boards of nonprofits, and thank you for that. Coming up May 12th is going to be a virtual online Zoom training session on how to be a more effective nonprofit board member during these difficult times, and you can find that on our website. And Justin, I really appreciate the time and mostly appreciate the interrelationship that we have in our community between business, nonprofit, and the governmental sectors. It really does make us stronger together.
Thank you, Tom. And yes, we did send out some information on Giving Tuesday Now last week, and I will send that out again this morning to the whole list. So if anyone on the call has the opportunity to give, take a look at your email, and it will have the list. How many? Were there 18 nonprofits on there, Tom?
Yes. But, I would say those are just the ones that had the time to help focus on this. And it's not about any specific nonprofit. I would think about the ones that people have relationships with or are doing important work. Duran Union Station, the Y, Respite, Salvation Army, all of them doing important work right now. So however you feel a connection or feel a calling, it would be wonderful.
Very good. Well, thank you, Tom. I appreciate you taking time to be on the call today and for all that you're doing to support our nonprofit community. Okay. Our third speaker today, as I mentioned at the start, we are going to begin rolling out daily different businesses that have Shiawassee County ties that can provide a product or service to help companies with reopening. And what's interesting, Larry talked about there not being enough thermometers to be able to test folks. Well, our business today, that's actually a service that they're able to provide. So Barry Paxton from Right at Home is the company we want to highlight today. So Barry, are you on the line?
I am.
Okay, go ahead.
Perfect. Thanks, Justin. I appreciate it. And Tom, thanks for the update and information as well. As most of you know, I'm the owner of Right at Home. We are primarily a senior in-home care and assistance company providing the seniors in our communities with personal care, things like bathing assistance, toileting assistance, companion care, and then homemaker services. One of the additional services that we're now offering is employee temporal screening. So temperature screening, as we had talked a little bit earlier on the call, obviously businesses are starting to reopen, and that's one of the services we've had a significant increase in demand. So all of our caregivers are licensed, insured, bonded. They have full training on touchless temperature screening, and we're available 24 hours a day, 7 days a week. What we found was that many, in particular manufacturing agencies or manufacturing companies during shift changes, banks, credit unions, funeral homes have had a significant need, but they don't necessarily have the capacity of staff to be doing the temperature screening and also the monitoring and recording of that. So what we've been able to do is we have trained professional caregivers that are able to come in using the infrared non-contact thermometers, and then we follow your specific safety protocol. And so basically what we've been doing is upon arrival at a shift change or upon arrival, we'll do the touch-free scanned temperature. And if they're outside of that normal range, it's based on your safety protocol, or we'll use, set county protocol as well. Then what we would do is we'd ask them to talk with someone in your health department, or we would just simply ask them to leave until their temperature comes back down. So it's a pretty seamless, non-contact. We provide all the PPE for our employees. So essentially all you need to do is, and I think, Justin, you're going to send out that summary flyer of how to get a hold of us?
Yes. Yep.
Okay, perfect. And all you need to do is simply reach out, and we'd be more than happy to talk to you about the services we can provide and how we can potentially help as people begin to reopen up.
Okay. Barry, thank you very much.
You're welcome.
Much appreciate all that you're doing. And yes, we'll be sending out the information from Right at Home. And please do, if that's a service that your company needs, please get in touch with Barry and his team, and I know they'd be happy to help you. So, okay, well, we're about 40 minutes in, so I know we're probably getting a little bit short on time, but wanted to touch on a couple of other items real quick. Learned something kind of interesting regarding the PPP program, Paycheck Protection Program. We talk about the money situation daily, but actually got a little bit of guidance yesterday that I think is helpful as it relates to companies that are trying to rehire people that those people don't necessarily want to come back to work. So that's been a challenge. I know we've talked about it on the call a few times about people maybe wanting to stay on unemployment. The guidance that we received was that as long as companies make a good faith effort to rehire people, as long as they put that in writing and can document that offer was made, if the person chooses not to come back, that will not be held against the company as it relates to turning the PPP loan into a grant. And I think that's critical because, once again, the premise of that program was that you're obviously supposed to keep people on staff or rehire and maintain employment levels. And so what that does, I think, is it allows those businesses, even if you're not able to bring some of your people back because of that issue of they want to stay on unemployment, you won't be penalized in terms of, losing your grant opportunity for that loan. So, obviously it's a case-by-case, company-by-company basis, but I think that is somewhat encouraging. I would be happy to talk with any of you offline about your own situation and how to handle it. So there's that. The money does continue to go quickly. I mentioned yesterday they were already $175 billion in terms of their spend down. I did have a couple of conversations from some new folks yesterday. So there is still an opportunity to get applications in. Don't know how likely it is, but if you do want to pursue, please let us know. Not every institution is taking new applications. Some are. So please let us know. The other program, the EIDL, there was also a new development yesterday that I wanted to share that might be applicable to some of you. They have reopened new applications for that with the caveat it has to be an agricultural business. So they have now made agriculture-related businesses eligible for that EIDL, and that's the one with the up to $10,000 grant advance. So if there's anybody on the call that's either agriculture or probably food or anything related to that, that portal is now reopened for consideration. So once again, if anyone has any monetary questions, funding questions, please feel free to get a hold of us. So we'd be happy to talk to you about your options. Jody in our office is going to begin the outreach process, I believe today, right, Jody, with the companies that, like Barry, that are offering these goods and services to be able to help with reopening. So we want to build sort of our own local spreadsheet of companies that, do that stuff. So it'll have names, contacts, what they do, quantities available, if it's a product. We just talked to one yesterday that bought a ton of masks and can't use them all, and so they're willing to resell them at the price that they got them for. So those kind of things. And so, Jody, you'll begin that outreach process today to companies to get that information. Is that right?
Yes, I will be reaching out probably just after lunch when we're done with our meeting.
Okay. And then we will, as I said, we're going to continue on a daily basis to highlight companies like Barry's that can do this. We want you to be aware. Obviously, everybody's going to need this stuff, and if we can find a local contact, a local connection versus, trying to go on some website somewhere and talk to people you don't know, local is always preferred. And we'll also share any information Larry Johnson can provide on that too. So more to come on that. And then I mentioned the gift basket thing yesterday. I won't go into that today. I will say, though, I personally talked with 12 more small businesses yesterday and am buying baskets for them. I'm probably going to be delivering, or they're going to be delivering some baskets to people on the call as a thank you for all you're doing right now. But I would encourage you, if you want to support local business, if you'd like to get some gift packages from local companies, food, things like that. We have a database to offer you of contact information if you'd like to do something nice for your employees. So, and then the last thing, jobs. I always mention that as the last thing on the call every day. Did receive a nice note from one of the companies that shared their job information with us. They've been able to hire, I believe, 3 people from our promotion. So we do want to get the word out there. If you have anything, you need to fill in terms of positions, please let us know. We'd be happy to message that. So with that, we're a little bit later than we normally are, but it was a great agenda. Any comments or questions from anybody on the call? Hit *6. Any other comments or questions? Anybody have anything they want to talk about? Okay. Well, thank you all. Thank you, Larry Johnson. Thank you, Tom Cook. Thank you, Barry Paxton. Hope you all have a good day. We'll talk soon.